You're
joining
most
the
welcome.
yeah. So you are talking to us about
Oh, yes, about the experience and how we interpret it. So when you explore that unconscious part of the mind and you trace the negative thoughts, okay, you failed an exam, and if I fail an exam, does it mean I'm stupid? Does it mean I will never pass again? Does it mean, when you explore it and you make the patient or the clients realize that some of those thoughts are either extreme, they are either unrealistic, and you figure out the other variables that could be a reason to why they failed. They get to a point of realization. Sometimes it may take a longer process, especially if the depression or the negative experience has gotten to a point where it starts causing neurological implication. But when you can trace some of those negative thoughts and realize that those thoughts are negative and evil and not directly linked to the cause of your negative experience, you end up finding out that, okay, you are feeling better about the situation and gives you more motivation to try again, try again, rethink again, challenge those thoughts, challenge those negative thoughts. So it's very, very important. The experiences you have, your interpretation of it is very important. And because this thing functions at the unconscious part of the mind, the parts we are not aware of, it's very sensitive. We don't have the capacity to tap into that part. Okay, this is the negative thought I'm having. So you need that psychological intervention that has, an empirical backing and an empirical procedure to go through a step-by-step process. Sometimes you give exercises every week, any negative thought that comes to your mind, you process it, you analyze it, you subject it to empirical evaluation. You challenge those negative thoughts, you challenge those cognitive distortion. Before you know it, you start feeling a lot better. That's even another level of, it boosts your emotional intelligence, it builds your self-awareness. Being able to identify your emotions, the cause of why you're behaving the way you're behaving, the negative thoughts you're having, you just feel that you are feeling better. Your life is better. You are being more positive. You are challenging a negative thought that's come to your mind. You are seeing the facts and the reality to why you had this experience. And at the end of the day, it works like a sequence. Your emotions start getting better. You start feeling happier. You start feeling more comfortable and everything. So that's just a typical example of a strategy used for depression. But when it's therapy, obviously it takes a longer period of time and a more step-by-step process, but I just give an overview. So it's very important. Your emotion, your interpretation, the empirism behind these processes. Psychotherapy is basically talk therapy, but it involves some level of empirical approach, scientific tools. If you want to assess your personality, for example, you use a personality assessment tool, you give a questionnaire, you get your questions, you evaluate it through an empirical process. You use your scoring system, you bring out the results, you give your client the report, you relate the report to their experience and their condition. So yes, it involves a lot of empirical and scientific strategies and tools when you're doing psychotherapy, when you're trying to deal with or resolve an emotional problem.
Okay. All right. So that's a very good one, because people need to know that these things are not just theoretical,
yes.
They're practical tools that, we go through this process and all of those. Okay. All right. Yes. So I don't know whether I can't see questions because of, I don't know why it's not showing the questions, but can you see any question? I don't know why I can't see.
Yes, I think I can see one question. What if after seeking professional help, it doesn't help the individual in need? What is the next step? Suggestion, do psychologists take advice for such individual? Okay, basically, because psychology itself, the mind is very sensitive. Human beings, there's no one way to it. To every rule, there's an exception. When you are dealing with emotional issues and you go to seek professional intervention, there are even too many subjective factors. Sometimes if you enter a therapist room, because you don't like the way the therapist looks, your bond with that therapist is gone, and there's nothing the therapist can do to help you again. Those are the sensitive things we have to put into consideration. So it might not be the therapy strategy itself. It might be the person you are seeing. Maybe the person is not getting you. Maybe you are an African person and you have an African perspective, and you came from Nigeria or maybe another part of Africa, and our culture is different, and you're trying to get intervention from someone that is foreign that might not really understand your subjective cultural, variabilities or variables. Let me put it that way. So it might be very difficult for that kind of therapist to help you. So if you are having problems seeking a therapist and or somebody or a counselor, counselors to help a lot. Like what you do, it might be a more functional approach for someone maybe in the African community to seek you to get you to intervene in their problem than meeting and maybe a foreign or a therapist, a certified therapist from another culture. So the person you are expressing your emotions to, the person you are seeking counsel from, is also very important. You know, there are clients that I've met, especially a couple of years ago when I first started, and because I look young, they don't think you can help them. There's nothing I can do. You have to refer them. You know, so those things are limitations that you can't do anything about. So if you're seeking psychological intervention or advice from the right source, the right, like you said, you gave a very good example, someone that is ready to listen. It can be different variables, someone that you are comfortable with emotionally. There's already an opening. There's already a connection with you and the person that wants to counsel or intervene. It's very easy. You know, that's why as professionals advised, especially as psychologists, to be very sensitive with your clients. You know, you do a lot of listening and not talking. You evaluate your clients, use your clinical judgment to, you know, create a connection and bond with you and your client or your patient, so that you don't ruin that first impression, that first interaction you have with the client. Because at the end of the day, when you ruin that, there's no amount of magic. Even if you are bringing the theories from anywhere in the world and you have read all the books, you've lost that client. There's nothing that can happen. So if you're seeking professional intervention and nothing is working, it's advisable you change your therapist, or you look for somebody else that is more relatable to you, that can intervene, that understands you, that maybe cultural variables, it could be how the person looks. You know, the mind, like I said, is very unconscious. You might be seeing a therapist that probably looks like maybe someone, as if maybe, let me give you a typical example, maybe a lady that was probably maybe assaulted growing up as a child, and maybe the therapist now looks like that person, and unconsciously you already have a natural reverence towards that person. There's no way the person can help you. So you have to put these things into consideration. You can talk to them sometimes, tell them that, open up, you know what, I feel this is not helping, I feel, okay, you cannot derive a strategy, you know, to go about it. So most times it's always good to be aware and connected to the person that is trying to intervene, so that you leave yourself open to be helped. Let me put it that way.
Okay, so I have a question here. Somebody saying,
yes.
He says, I can't tell if I have a brain problem or a mind problem. How can I figure that out?
Okay, now we are talking about the spectrum of normality. And I would like to tell you something. There's nobody on this planet that is typically normal. I'm just joking terms, but let me just put it that way. You know, as an individual, statistics even show that the average human being would go through, or have gone through, is going through, or will probably go through in future, a kind of psychological or emotional problem or mental health related problem. So no matter who you are, no matter what you are, don't judge yourself. There is something that is, normality is very subjective, it's on a spectrum. So you could be going through something, you can't say you have a brain problem without doing any evaluation, but yes, you could be susceptible to something, you could have depression, you could have, you know, any kind of issue. So the only way you can tell you have an emotional problem that requires intervention, because most of it might not require intervention, is when these problems or this emotional issue starts interfering with your day-to-day life, starts causing there's something we call clinically significant distress. You know, a problem that is interfering with your work, you are being less productive, your relationship is hurting, your emotional state is hurting. Maybe for depression, for example, you can't go to work, you are not functioning to your maximum capacity at work. That's a clinically significant distress. Or maybe your relationship, you're always snapping at your partner, you're always shouting at your partner. That is a clinically significant distress. It's affecting something in your life. So then you know, okay, I have a mental health problem that I need to get intervention for. But people are not even aware that the causes of those negative behaviors are even emotional in the first place. You know, that's why things like this have to just keep going on. You know, why I appreciate, you know, you for, you know, facilitating this platform to keep promoting this idea. Mental health related problems is a thing. Let's understand it. Let's know that there are things we can do to resolve this problem. So it helps a lot. So the number one way to know that there's a problem is your behavior, your interaction with life. Is it affected? Is there a problem? Is there finding out that, okay, your interaction with people is negative, your interaction with work is negative, your interaction with life is negative? If there is something like that, next thing, adopt the strategy of emotional intelligence. Try to start asking yourself, what's going on? What's the emotional problem? What's this? What's that? Before you know it, you might now say, okay, let me see a therapist. Before you know it and you see a therapist, you might now have brought out something. Maybe you are going through a severe anxiety disorder, or a severe panic attack, or you are depressed, or you are bipolar, or something that could be very, very bad. If you notice that there's something abnormal about your interaction with the world, then there's an emotional problem or mental health related problem.
Okay. So let me take one more question. I can't see my own comments, but I have
Oh,
a
okay.
question from, yeah. What if my circumstances are causing a portion of my emotional pain? How should
What
I,
if
my circumstances that I'm going
okay.
through right now are causing a portion of emotional pain for me? How
Okay.
should I go about handle such situations?
Definitely, naturally, the way life is, your experiences or stressors in life will cause emotional implication, will cause emotional pain. And if you find yourself in that situation, I believe it's such a good, I'm such a huge facilitator of emotional intelligence,
Okay.
self-awareness. Being able, that's a fraction, that's the internal, one of the internal aspects of emotional intelligence, self-awareness, being able to identify your emotions. If you see that something is going wrong, naturally, if time should take its course, those things will frizzle out, those negative feelings will frizzle out. But when you see that it keeps staying there, so maybe something has happened and you keep feeling down emotionally, it's stressing you too much emotionally, go inward and start trying to figure out what the problem is. Why am I feeling this way? I'm feeling down. What could be wrong? This, that, this, that. When you do that and you identify that there's a problem and you make conscious efforts to cope, those strategies, you now adopt those strategies we are talking about. Try to cope positively with the stressors. Maybe if it's something that is as physical as, okay, work 10, pressure from work. You adopt a coping strategy like, okay, when I come home, I'll try to relax. I'll watch something that will just make me relaxed and do something constructive. When you do all those things, you adopt those coping strategies and they work and the stress reduces, you are fine. But if it doesn't, that's where you have to seek professional intervention. So one of the best ways to figure out an emotional problem or to figure out if there's anything that is any experience that is affecting your mental health is to have a very sensitive part of yourself, which is self-awareness. Be very conscious of your emotions. Be able to look inward, meditate. Think about how you are feeling. Think about what is making you feel the way you are feeling. Then start looking for proactive measures to fix those things. That's the most important thing. And if those things don't work, professional intervention or any kind of intervention is very important.
All right. So I have two questions, man. Then we'll be done today. It's okay. Now we have spoken about mental health and all of. What, from a psychological point of view, and as I said, what do you conceptualize as good mental health? What would you describe as good mental health?
Good mental health is basically being able to function in the environment in a constructive way and in a positive way. Your emotions don't affect your productivity, doesn't affect your relationship, doesn't affect your interaction with people. It's very simple. It's just that simple. A good mental health, this person is an individual that is able to interact with the world and himself functionally. No problem. No, not like there won't be any problem at all, but the severity is not very high. So that's basically good mental health, your ability to interact with the environment and yourself emotionally, functionally, without creating distress, without negatively affecting yourself and the world around you. That's just good mental health or good emotional health.
Okay. So ability to relate with people when there are issues, it doesn't take you off, and then you're still able to relate and all of that. That's a lot of work. There's a lot of
it's very true.
There's a lot of work in that. Even that's why what I'm doing is not something that I will have done before. Sometimes our experiences helps us to be able to know that we are not immune from things that happen in environments. So I've learned more. Right now, one of the things that 2020 has helped me, and with the lockdown, is that helped me to be more compassionate with people. Because one of the things I believe strongly right now is that the world needs more compassionate people. Let's look at the story of Chadwick that we God bless his soul.
Yes.
I remember I felt very from the time that we are ahead of the story and everything, I just felt very, very bad. And I've been a proponent and advocate for people to be more compassionate before you comment on any situation, whether online or in a discussion. Ensure that you have all the information. Ensure that you are not biased. If you don't have enough information, and you're not going to pray for the person, do not comment.
Yes.
Because look at his story on Twitter. His last picture, he was shrinking and everything. People were abusing him, they were insulting him without knowing what he was going through. And that's just the way the world is. People, they were commenting, abusing, and this person has been battling colon cancer for the last 4 years. And he has been strong and everything. So I'm an advocate for people to keep their mouth shut when they don't know what the other person is going through. Yeah.
Very good.
And, yeah, lastly, somebody said, I am in a lot of pain and distress right now, and I need immediate help. What should I do?
Like I always say, you can contact a professional, or not necessarily a professional. The person could contact you, evaluate the situation. You know, it's very simple. When you've tried something yourself, when you've tried to resolve some issues yourself, and you see that there is no resolution, it's always good to get an intervention, get help. It's very good to get help. You know, if you are going that whatever you're going through now, obviously you don't have the capacity to deal with because you don't know how to get out of it. It could be easy as maybe going online, finding out the symptoms of some of the possible cause of some of what you are feeling. And when you find out or you know what is going on, contact somebody that can help you with that situation and explain what you've discovered or known about the situation to them. So in that situation, I'll advise you to seek intervention because it's very ambiguous for me to just come to say, okay, this might be what's wrong. You know, there might need to be an evaluation. What it could be social anxiety disorder, it could be depression, it could be any emotional issue. It could even be something just a family feud or something. So you have to be able to contact somebody to get help and know what is going on and get the appropriate intervention.
Okay, so you should talk to somebody first, and if that person cannot, should be able to refer them to where they can get help. But they must talk to somebody first.
They must talk to somebody.
Okay. All right. Thank you very much. I don't want to take more time. It's been a very wonderful time. I'm going to ask everyone, this video will be saved on my IGTV. So anyone that needs help, need to talk to somebody, we have a professional that's my guest today. And then he's going to be able to assess, and then he's a professional. So he's going to be paid for his services. Okay, that is.
I didn't do an introduction. Sorry. Okay, so I'm SEYE. I'm a clinical psychologist, mental health advocate, and a psychotherapist. You know, I've been practicing for about 3 years, and I've had a lot of positive testimonies. Let me put it that way. Yeah. I know it's technology, but that's just an introduction of myself. Yes.
Yeah. So everyone, I'm going to ask them to follow your website. And then, yeah, and then they can follow you. I'm going to put your handle on the IGTV so that people can follow you, talk to somebody. Anytime you need help, you can always reach out to somebody. Help is always available, even before the problem ever existed. So please talk to somebody, seek professional help. Don't be afraid. Don't be scared of the stigmatization. Just seek help. You need help, seek help. And then there'll be solution for whatever situation is. If the solution is not with me, I will always refer you to where you can get the help from. So thank you so much, SEYE, for making our time.
It was a pleasure to be here. Thank you so much.
Such a long time. Seeing your face now.
Yes.
Such a long time.
It's such a pleasure. I'm so excited to be here. To see you as well.
Thank you so much, SEYE. And I'll be reaching out to you again if I have any question or
no problem
somebody talks to me, and then I will refer them to you. Okay?
No problem at all. Thank you so much.
Have a good time. Have a good night. Thank you, Baba.
Good day.
Yeah, bye-bye.